Hi everybody, welcome to Camglish.com online teaching guide for beginner students. My name is Teacher Angel and let's start our lesson in the Oxford Picture Dictionary. Hi students, this is our lesson or part 2 of our lesson under the topic hospital. A hospital. We are going to learn another set of words. But before we discuss the part 2 of our lesson, let's have a short review of the previous terms we learned. Are you ready? We had the terms obstetrician, internist, cardiologist, pediatrician, radiologist, psychiatrist, ophthalmologist, X-ray technician, bed table, call button, hospital bed, bed control, bedpan, medical waste disposal, hospital gown, lab technician, blood work or blood test. Let's try to know the people we can see or we can find in the nurse's station. Nurse's station. Of course, in the hospital building. In number 18, we have what we call orderly. Orderly. Orderly is someone who cleans and does other basic work in hospital. Okay, such as this. Alright. And then, next person is what we call the volunteer. Volunteer. Volunteer is a person who offers to work or help without pay. Okay, volunteer. He's a volunteer in the hospital. Next, in number 20, we can see medical charts in the nurse's station. Medical charts. Okay. This is where nurse and doctors write patients' information in their analysis. Medical chart or medical charts. Very good, students. Next word we have or term the vital signs monitor. Vital signs monitor. Again, vital signs monitor. It is a machine that monitors the signs that indicate the health of the body, such as pulse, temperature, and rate of respiration. Again, rate of respiration. That is the vital sign monitor. And then we have, of course, the registered nurse. RN, abbreviation for registered nurse. Yeah, she's a nurse. And then we have the medication tray. She is carrying a medication tray, right? Next term we have LPN, abbreviation for licensed practical nurse. Licensed practical nurse. We sometimes call her licensed vocational nurse. Licensed vocational nurse. Okay? LPN and LVN are just the same. Okay? And then we have the dietitian. 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 Dietitian is a person who is trained to plan healthful meals for both ill and healthy people. Dietitian. They have different jobs inside this hospital. and all of their jobs are really important. All of them are really important. They have roles to do, different important roles to do. Okay, now let's continue and let's have the term in number 26. After the nurse's station, let's now proceed to the emergency room. Emergency room. Alright? Have you ever been to an emergency room? Who helped you there? We are going to meet people who can help us when we're at the emergency room or we're in the emergency room, such as the EMT, or emergency medical technician. Emergency medical technician. Alright? And in number 27, we can see here the IV, or intravenous drip. Intravenous drip. IV is an apparatus for giving medicine or nutrients through the veins. IV is an abbreviation for intravenous. Alright? This is really needed, especially when the patient is unconscious. Okay? It has a really big help. It gives big help to patients. Alright? Next, we have the stretcher or the gurney. Stretcher or the gurney. Stretcher or gurney is used for transporting injured, sick, or dying persons. Okay. This thing here, a padded hospital stretcher on wheels, okay, is what we call the gurney. Okay, this is used to transport patients. Gurney or stretcher. Alright? Let's now go to the surgical or to the operating room. Let's enter the operating room. This is the operating room. We can see surgical nurse inside the operating room. Surgical nurse are nursed on different wards to surgical patients who have undergone a minor or major operation. Okay? Surgical nurse are nursed, okay, on different wards to surgical patients who have undergone a minor or major operation. Next, we have, in number 30, the surgeon, the most important people here. Surgeon is a medical doctor who does surgery or operation. He heads the team. Alright? In number 31, we have the surgical cap. He is wearing a surgical cap. Okay? Next, we have the surgical gown in number 32. This is what we call surgical gown. Alright? And then in number 33, we have the latex gloves. Latex gloves. Okay? Again, they are wearing latex gloves and surgical cap for sanitary purposes. Alright? And then in number 34, we have the operating table. Operating table. Okay? And finally, we have the word anesthesiologist in number 35. He is what we call the anesthesiologist. He is a doctor who specializes in applying anesthetics. Anesthetic is a drug that causes numbness in the body or loss of consciousness. This is very important, and his role is really important.